CNA versus LPN versus RN. Welcome to the quiz. Question 1. You are assisting Mrs. Margaret Morrison, a 72-year-old female patient with her personal hygiene care. You are providing nail care by trimming her fingernails. You understand that proper nail care is an important part of hygiene and health maintenance. Based on purposes of providing nail care to patients, which statement best describes the primary purpose of nail care in patient hygiene? Option A. Nail care is done only for cosmetic appearance and is not necessary for health. Option B. Nail care is important for preventing infection, promoting comfort, and maintaining the patient's appearance and dignity. Option C. Nail care is primarily done to punish patients for not taking care of themselves independently. Option D. Nail care is only necessary for patients who are able to shower or bathe in a tub. The answer is B. Nail care prevents infection, bacteria under long nails, enhances comfort, and supports dignity. Option B is correct. Options A, C, and D are incorrect. Question 2. You're reviewing personal protective equipment guidelines and learning when to wear certain types of PPE. You are trying to understand when it is appropriate to wear a gown as protection. Based on infection control guidelines and when gowns should be worn, when should you wear a gown as PPE? Option A. You should never wear a gown because it is unnecessary and restricts movement. Option B. You should wear a gown when there is a risk that your clothing could become contaminated with blood or body fluids. Option C. You should wear a gown only if the patient specifically requests it. Option D. You should wear a gown only during surgical procedures in the operating room. The answer is B. Gowns are worn when there is risk of contamination of clothing/skin by blood or body fluids. Option B is correct. Options A, C, and D are incorrect. Question 3. You are helping Mrs. Susan Lee, a 68-year-old female patient, to store and keep track of her personal belongings, including her glasses, watch, jewelry, and other items. You understand that patients' belongings need to be safeguarded to prevent loss or theft. Based on proper management of patient belongings, how should a patient's belongings be handled during hospitalization? Option A. Store belongings in any convenient location without keeping track of them. Option B. Store belongings in a safe, secure, accessible location and maintain an inventory of items to prevent loss or confusion. Option C. Lock them in a secure location without telling the patient where they are. Option D. Assume the patient will not need any of their belongings during hospitalization. The answer is B. Patient belongings must be inventoried and stored securely, with patient knowledge. Option B is correct. Option A risks loss. Option C, patient should know where their items are. Option D is incorrect. Question 4. You are caring for Mr. Kenneth Robinson, an 88-year-old male patient who has been receiving end-of-life palliative care. He is approaching the end of his life. His family members are at the bedside, and staff are focusing on comfort measures rather than curative treatment. You want to provide supportive, compassionate care. Based on best practices for caring for dying patients, which statement about death and dying is most helpful for a patient in end-of-life care? Option A. Avoid discussing the patient's condition and approaching death entirely. Option B. Allow the patient to express his feelings and concerns, maintain his dignity, provide comfort care, and support both the patient and family emotionally. Option C. Focus only on medical interventions and ignore the patient's emotional and spiritual needs. Option D. Tell the patient not to worry about dying and to focus on getting better. The answer is B. End-of-life care emphasizes dignity, comfort, emotional support, and open communication. Option B is correct. Options A, C, and D are not supportive. Question 5. You're assisting Mr. Lawrence Cooper, a 75-year-old male patient, with ambulation and mobility. You are planning to use a transfer belt to provide support and prevent falls during his movement. You need to position the transfer belt properly. Based on proper technique for using a transfer belt, where should the belt be placed? Option A, around the patient's chest under his arms. Option B, around the patient's waist over his clothing at the level of his hip bones. Option C, around the patient's hips very loosely so it will not restrict his movement. Option D, around only one side of the patient's body to allow greater mobility. The answer is B. A transfer belt is placed around the patient's waist, over clothing, snugly but not too tight, at the hip level. Option B is correct. Option A, chest placement, is incorrect. Option C, loose belt, is unsafe. Option D, one-sided, is incorrect. Question 6. You are participating in a quality improvement initiative focused on fall prevention in your facility. Part of the initiative includes modifying patient environments to reduce fall risk. You understand that the patient environment significantly affects fall risk. Based on proper environmental modifications for fall prevention, how should a patient's environment be modified to prevent falls? Option A, scatter furniture throughout the room to provide walking pathways through the space. Option B, ensure adequate lighting, keep walkways clear and free from clutter, provide grab bars in bathrooms and near beds, and remove tripping hazards. Option C, keep the environment cold to help keep patients alert and awake. Option D, remove all furniture from the patient's room to prevent any obstacles. The answer is B. Fall prevention includes good lighting, clear pathways, grab bars, and removal of tripping hazards. Option B is correct. Option A increases fall risk. Option C, temperature does not prevent falls. Option D, removing all furniture is impractical and unsafe. Great job! Don't forget to subscribe. Bye!